A stroke occurs when the blood supply to part of your brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. Within minutes, brain cells begin to die. Prompt treatment is crucial. Early action can minimize brain damage and potential complications. The good news is that strokes can be treated and prevented, and we are going to learn how in today's episode. Thank you for joining in today's program. My name is Joanna Mambia, and here's what's ahead on today's episode of Health and Flavour.
Maybe parts of the body, hand or leg can't work properly.
Done. My dear, this is what you should use. This is your massage oil. With your gloves, with your patient, you do the whole body.
A stroke is a medical emergency. Prompt treatment is crucial.
What is a stroke, and how can you prevent it? We went out to the streets of Nairobi to gather people's opinion about stroke. Here are the opinions we got.
Yes, stroke is this kind of disease that makes one part of the body dead, like it can't function. Yes. I think one, you should keep healthy. Yes. And also, when you have someone who is affected with stroke, just take good care of him and encourage him and everything. Yeah.
Stroke, I don't know.
Thank
Stroke is whereby maybe parts of the body, hand or leg can't work properly. What I know is a lot of exercise. Yeah.
Well, it's true that exercise can lower your blood pressure, increase your level of high-density lipoprotein cholesterol, and improve the overall health of your blood vessels and heart. However, what dietary adjustments should you make to prevent yourself from suffering a stroke? Our nutritionist, Hesperance Deodate, will now teach us natural food remedies we can employ to enrich our uptake. Stay put.
Now, the brain cells beyond the leak are deprived of blood, they are also damaging. Remember, it is this blood flow. When the blood is traveling, it is traveling with oxygen, and it is also traveling with the nutrients. So when there's a leaking, it means you don't get enough, or probably not at all. And that is depriving now the blood, the nutrients, the oxygen, where it will have gone to feed the nutrients. Another cause for this intracerebral hemorrhage is high blood pressure, trauma, vascular malformations, blood thinning medication. And then you have another one, subarachnoid hemorrhage, whereby an artery near the surface of your brain bursts and spills into the space between the surface of your brain and your skull. Between the surface of your brain and the skull, that surface, when you have an artery that spills there, then that is when you have this kind of leaking. This bleeding is often signaled by a sudden severe headache. Sometimes you have this terminology, we say mini stroke, okay, or mild stroke. It is a temporary period of symptoms similar to those you will have if you had a stroke. Temporary decrease in blood supply to part of your brain causes transient ischemic attack. It may last for 5 minutes to 10 minutes, but with similar symptoms of this other stroke. Now, seek emergency care even if your symptoms seem to clear up. It is important because in mini stroke or mild stroke, the patient is at a greater risk of having a full-blown stroke, causing a permanent damage later. There are symptoms. Whereby you'll see that something definitely is not okay. When you have of a suddenly trouble with speaking, you are not able to speak. You want to say, but you cannot coordinate yourself to speak. And sometimes somebody is talking to you, but you have trouble understanding. That again is a symptom that, of course, you will wonder what has happened to me. Over suddenly, you feel this numbness or paralysis. You feel like the part of your face is pulled in one side, or your arm or your leg is weak. Sometimes when you are walking, you just fall. You find that it is like there is a heavy thing that has been placed on one side, or either right or left. So then there might be, that is one of the signs or symptoms of stroke. And sometimes you want to see, but you find that you are seeing with one eye, or both, you are not able to see. Then that again is another sign. Headache, trouble walking, seek immediate medical attention. If you notice any sign or symptoms of a stroke, even if it seems fluctuating or if it disappears. There are lifestyle risk factors. Number 1, overweight or obese. There is this issue of exercise. Inactivity is one of the risk factors. Alcohol, use of illicit drugs such as cocaine, but high blood pressure. When you have high blood pressure, that is reading above 120/80 millimeters of mercury. You see that one, you just have to see that. Why is it going high? It is like, for example, this is where you are living. You are known to live in a certain estate. And then, over suddenly, you are found in walking towards and probably bordering to another estate. Yes, you are within. Yeah? You may say that you are within, but where are you going? It is like you are going to another state. So, when you see that your blood pressure is moving from 120/80, now it is going to 130/80. Now, this is home. Where are you going? So, that one is supposed to, it is an alarm that you need to take it back. There are some things that we'll discuss that will help you take it where it is supposed to be. Then there is cigarette smoking or second-hand smoking. We speak of second-hand smoking whereby you do not smoke at all, but probably you live with a smoker. Or you do not smoke, but the moment you feel that smell of cigarette, it means you have smoked. That is what we call second-hand smoking. And if it is regular, where you are working, it is where people smoke, in a casino, in a club, in a bar, oh, that is your environment. So it means they are smoking, but you are smoking, and you are at a greater risk than even people who smoke. Another risk factor is high cholesterol level, diabetes, when you have cardiovascular diseases, or family history of stroke. Another factor is age. The more you age, the more you are at a risk of getting a stroke. Now, sex also matters. Men have a higher risk of stroke than women. You see, it is not me. I'm only saying what the researchers have noticed, that men will have a higher risk of getting stroke than women. Then we have hormones. And the hormones that are pointed at are these pills, use of birth control pills. Unfortunately, they have to be used because of one reason or the other. But one of the side effects is this one. So we'll just mention it because we are here to alert you, to tell you that you use it, but there is another aspect of it which you have to be aware of. Now, there are complications of stroke. Paralysis, difficult talking or swallowing. There is this issue of memory loss. You are not able to think clearly. Emotionally, you are in balance. You are in pain. Change of behavior to adopt. Or sometimes you are just too irritated because things are not the way they used to be. Okay? Those are some of the complications. you can prevent stroke. And the way you can do it is, number one, control your high blood pressure. If you are able to control that, if you are able to even prevent it, the better. Lower your cholesterol to the normal levels. Now, there's another one. You need to learn to reduce the saturated fat or stop them at all from your diet. You do not have to. The body actually does not want the fat we use in frying onions. No, not at all. It needs fat, yes, but not that one. Not the one we use when we use coconut milk to cook. No, it is not that one. It needs it. It needs it fresh from the coconut, fresh from the seeds, fresh from the sunflower seeds, fresh from the sesame seeds, fresh from the almond seeds. It needs fresh from the walnut seeds. Just use the nuts. Use the raw nuts. It needs that fresh from the nuts, fresh from the seeds, but not the one that we normally use for cooking. When we cook, we change the chemistry, and the acceptability into the body becomes something different. The body does not take that one lightly. Quit smoking, my dear friend. The body needs oxygen. It does not need carbon dioxide and carbon monoxide and all those chemicals that we take to the body. So it is good if you quit smoking. But also, if you are diabetic, make sure that you control it. You must have been educated on how to control it. Just make sure that you control it. Maintain a healthy weight. Avoid illicit drugs. There's another way you can do to prevent it, and that is eating a diet rich in fruits and vegetables. This is very interesting. When I speak about this diet which is rich with fruits and vegetables, I do it passionately, because this is where we go wrong. I do not know when we started cooking and we made sure that cooking is just part of us. Cooking and more cooking. I'm going to demonstrate to you a quick meal, and assuming that I do not have what we call fire, and I do not have oil. Before me is soaked almond. Now with this soaked almond, I'm going to prepare a quick meal, and I can assure you it is going to be filling, and I'm also going to balance what the body needs. And this one will bless somebody who has stroke, or somebody who wants to prevent stroke from occurring. This is mango. So I'm also going to add into the almond, and I'm going to add the ripe bananas. You can see where I'm heading. I need the potassium, I need the enzymes. I don't want to kill it at all. I do not want to kill the food. I will want to take it the way it is supposed to be taken, whole. I will have added here even the walnuts or sunflower, but for today, I will only use this one. I will have also used something else. Let me give you a hint. I will have used chia seeds, flax seeds. I will have used those ones, but I will not use it. But I'm preparing a meal. This is called a meal, okay? The spinach is very fresh. It is very fresh, and I'm going to add all of it. This is going to be a meal and a half. But all I'm trying to tell you is that you can prepare a quick meal which is suitable for somebody who is recovering or who is trying to maintain or to recover from stroke, or somebody who cares for the weight, somebody who cares for his status, diabetes or whatever. So this is what I'm going to do, a quick one. And because I'm dealing with a stroke person, I want to add an onion. Okay? I want to add this onion. It is slightly big, but I will add it anyway. Okay? And I will also add some garlic. Those ones have enzymes that are helping the blood to thin naturally, but not to thin beyond what is expected. Okay? Now, I told you that I was going to prepare a meal. When you see an onion, you just want to fry it with onion, with oil. But we look at it, we just want the enzymes. And enzymes are only found in raw food. Done. My meal is ready. And when you take this one, look at it. Everything is fresh. Everything is good. And look at it. Yeah? You cannot compare this one with what you have eaten. You cannot. I don't want to mention it. I don't want to mention what you ate. But you can never compare it. You can never compare. The nutrients that are here, you can never compare with any plate that you ate of, I don't know what starch and what animal product and what oil and what food colors, and you can never compare. This one is very fresh and the brain is waiting for it. And the body, the blood, the heart, everything is just waiting for it. We need to learn to eat natural food. At the same time, we need to learn to exercise. Not only that, this natural food, do not forget green tea. I'm tempted to test this thing. I'm so tempted. Let me tell you. I'm going to leave some for you. Definitely, I will leave this one. I'm not going to finish it. But it is just good. Do not forget the green tea. Do not forget other fruits in moderation. But also there's something else. There is therapeutic massage. I'm going to keep this one for you. But a quick one for somebody who has stroke. You need to do something for that patient. And this is what we call garlic massage. I will show you a quick one on how to prepare massage oil. And this massage oil will be prepared using garlic. So these are fresh garlic, okay? And then I'm also going to use olive oil. You do not use the kind of oil that is not safe to the body. You use the one that is safe. So with this one, you do not add anything else. You just want to get the enzymes that are necessary. Do not forget that garlic has a certain sulfur compound which is enabling, which is very healthy, but also it is aiding in blood clot. Done. My dear, this is what you should use. This is your massage oil. With your gloves, with your patient, you do the whole body. Start from the legs, go to the head, follow the arteries, invigorate the muscles, and work on it, the whole body. Let me tell you, you do not know what you are just going to do, but you are going to do something very good for this patient, and you are going to assist this patient recover, remove the clots, but also feel better, okay? There is something else from garlic massage. You need to balance or to manage the stress. Stroke does not need stress. You can also use turmeric, but use onions and use onions, and you can also use garlic generously. I'm also going to serve you I want you to see how to serve your meal with whatever you'll have used. I have prepared generously the salad which has onions, fresh onions. They have not been washed by any salt. You need to take them raw. Learn to take food as it is. It is an art. It takes determination. But like this one, what you'll have done again is generously to use olive oil. All right? When you use olive oil and you use the seeds before you, and you can eat it with anything. What do you want to take, for example, today? Do you want to take potatoes? And what about legumes or whole grain? You can boil this one just as it is, or you can take, what do they call? You can take hard porridge, ugali, out of this whole. But if you take it, remember to take with salad. Whatever you're using it, take the food the way it is almost naturally found. There is something else that you can do. Apart from the seeds, I want you do not forget the omega-3. Omega-3 will aid this brain to heal so quickly. Omega-3, use omega-3 generously. Fish oil, wherever it is found. But try as much as you can to balance the omega-3 and omega-6. You will find the omega-3 and omega-6 in some seeds, but you'll also find omega-3 fish oil, and try to use it generously. There are some vitamins that are very good for somebody who had just gotten a stroke. The folic acid is very good. Vitamin B12, vitamin C, vitamin D, vitamin E. Now, magnesium. If you take calcium, magnesium, that balance, it is extremely very well. What I'm trying to tell you is that there are things that are just too good. We don't use them generously. I do not know who has bewitched us, but an avocado is excellent. Fruits are very good. Vegetables are very good. Raw vegetables, seeds and nuts. Exercise, invigorate the muscles of that patient. You can recover from your stroke. You can get up, you can wake up, you can walk again. You can do that, but eat correctly. You have to work on your lifestyle. You just have to trust that it is possible. And yes, it is possible, and I'm guaranteeing you. Thank you very much. I wish you well. And these are natural remedies for most of the challenges that are happening to us today. And I wish you well. Walk naturally and do naturally and be blessed naturally, because God wants us to be blessed. Thank you very much.
In addition to recommending lifestyle changes, Dr. Fesahat Tsegaye, a public health specialist, will explain more on routine habits you should commence to prevent yourself from getting a stroke.
Hello viewers, my name is Dr. Fesahat Tsegaye, a general surgeon and a public health specialist. I do love to take a brief moment to review today's topic on stroke. A stroke or brain attack arises when blood circulation to the brain fails. Brain cells can die from decreased blood flow and the resulting lack of oxygen. There are two broad categories of stroke: those caused by a blockage of blood flow and those caused by bleeding into the brain. A stroke is a medical emergency. Prompt treatment is crucial. Early action can minimize brain damage and potential complications. Prevention strategies in stroke include: 1. A healthy, balanced diet, which is crucial for a fit heart and blood circulation system. This should include plenty of fruits and vegetables, whole grains, fish, and pulses with restricted salt, sugar, and fat intake. 2. Take regular physical activity. Exercise at least 30 to 60 minutes of regular, moderate intensity physical activity every day helps to maintain cardiovascular fitness and helps to maintain healthy weight. 3. Tobacco use in every form is harmful to one's health and must be stopped. The risk of stroke starts to drop immediately one stops using tobacco products and can drop by as much as half after 1 year. Number 4, have your blood pressure checked and know your numbers. If it is high, lifestyle changes, incorporating a healthy diet with less salt intake, increased physical activity, and medication will be necessary. Number 5, raised blood cholesterol and abnormal blood lipids increase the risk of suffering stroke. Blood cholesterol needs to be controlled through a healthy diet and, if necessary, by appropriate medications. Number 6, regular medical checkups is an important aspect of preventing stroke to individuals at high risk, for example, people suffering from diabetes. To prevent a stroke, eat a healthy diet, avoid smoking, maintain a healthy weight, limit use of alcohol, and get enough exercise. Anyone can use these techniques to avoid a stroke, regardless of age or family history.
Being overweight contributes to other stroke risk factors such as high blood pressure, cardiovascular disease, and diabetes. Losing as little as 10 pounds may lower your blood pressure and improve your cholesterol levels. A diet containing 5 or more daily servings of fruits or vegetables may reduce your risk of stroke. Gradually work up to 30 minutes of activities such as walking, jogging, swimming or cycling on most, if not all, days of the week. Thank you for watching today's episode of Health and Flavour. Until next time, I have been your host, Joanna Manga.